Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert, and I am sitting here today with my most banged up and wounded colleague, Dr. Millicent Ravello. How are you doing, Dr. Ravello, after your big accident?
I've had better days. Huge accident. Rough.
There's a reason this one isn't on video.
It's so true. Usually we video these, but my face is not up to camera ready.
What happened, though, exactly? Now, I had another patient who will remain nameless because they're a very, very big name person who had a battle with a garbage can and lost. And they lost very big. Split ear, all kinds of injuries. Yours looks like it's just a couple of abrasions, but did the wind take you, or did a tree fall on you while you were...
Okay, so here's the true
story. Did a raccoon attack you for the garbage? What is it?
No, I was doing my recycling, and here's the real truth. My neighbor was outside, and I'm sure he wasn't watching me, but I felt self-conscious, and I wanted to be a good neighbor and a good citizen of the world. So I was really trying to smash my boxes into the recycling bin and not leaving them all like open and boxed so that there'd be room for other people to like put stuff in there if they wanted to. And I didn't want the garbage bin to have a big open lid. So I was trying to be a good person. So I was really leaning down into the trash can, trying to smash these boxes in. And when I lifted my head up, the lid of the trash can just smacked me in the face. And it kind of went... So I have like a forehead thing, I have a nasal thing, another nasal thing. It dinged me up pretty bad. So yeah, that was me versus the trash can. I will say I might have won because I filled that trash can pretty full. It was stuffed.
So worth it.
It was worth it.
So if you want me to do, you don't have to break your nose for me to do a rhinoplasty. If you want me to do it, I will just do it. You don't have to undergo, because that's always a question. What if I break my nose? Can I get a nose job? I was like, well, you'll have a broken nose then, and then you'll need a nose job, and it's not optimal. So.
It's pushing me towards my future septorhinoplasty, which ironically enough is part of the topic of today. But just to finish off my altercation story, I was thinking about your patient, the one that you just referenced who had his ear sliced off by a trash can. I was like, oh my gosh, I'm that guy.
Totally. It's like, you see it all. That's part of the deal.
And of course, today or this week, I'm doing some filming for some TV stuff. And
of course,
this is the week I get all banged up.
That's right. Can we talk? Your TV show is not public knowledge yet, is it? Or is it?
Well, apparently now it is. But no,
it is?
No, it's not.
Oh, it's not. Okay. Well, all right. I won't talk about that. That's coming. What we do want to talk about today is septal reconstruction, the reconstruction of the nasal septum, because it comes up all the time in the context of primary rhinoplasty, revision rhinoplasty, cocaine nose reconstruction, cleft lip and palate reconstruction. I just did a massive cleft nose reconstruction that required a lot of septal work. So reconstructing the septum is a topic that needs to be addressed just because it's not simple. And it's not something that people really, like the average plastic surgeon doesn't really want, the average ENT surgeon doesn't really want to go and do total septal reconstruction unless it's really forced upon them.
Right, and unless it's something that they do pretty routinely, because it is a complex procedure and it is not for the faint of heart. Because for a little background here, the septum is that middle part of the nose. It's the thing in the inside of your nose that separates the left side of the nose from the right side of the nose. And if you've ever heard of something like a septal perforation, it's when there's a hole in that septum and it allows air and fluid or whatever to communicate between the two sides. So a septal reconstruction is when you really have to take that septum apart, take it down, put it in a new position, do something to it to make it better for a number of reasons.
Yeah, and septal reconstruction comes in a lot of, flavors. Everybody knows the term, do I have a deviated septum?
Right,
That's the big question.
Yeah.
Usually when the patients are asking that, they don't really know what that means, and it's okay, but they know that might get insurance to get involved in their